So hello everybody, welcome to another episode of What's Next After BDS, edition Royal College of Surgeons. And today I have with me Dr. Goldie, and she has currently completed her MFD-1 UK or London. So Dr. Goldie, can you please give a short intro about yourself?
Hello, my name is Goldie Christie Cletus. I'm a dentist. I basically passed my BDS from Kerala, India in the year 2019. Did 1 year of internship, passed out in 2020. After doing 1 year of clinical work in Kerala, I moved to UK. I'm a registered dental therapist here, which means that I do work on prescription, all kinds of dental work under prescription. I can't currently prescribe any antibiotics or do extractions or do root canals, but generally everything else. I'm also preparing for my ORE Part 1 here. Yeah.
That's fantastic. So getting a license is the next step for pretty much ORE. So let's focus on the MFD Part 1 today here. So as we know, there are a lot of Royal College surgeons. Was there any specific reason as to why you decided to take the MFD-1 UK? Of course, there is no like something like, this is superior, this is inferior, at least as far as I know. But any specific reason as to why you took the MFD-1 UK?
Basically, not really, because I work in Wales now, and like England is, the most easiest, and the nearest RSC England. Like for me, take Ireland or Scotland didn't mean much. So I thought, oh, England. Yeah, that's pretty much. And also, I'm aware that you can change. You can write your MFD Part 2 and change if I want to. So yeah.
That's good. That's good. And I think recently, after the especially post-COVID, now they have made most of the exams online. At least for Ireland, both Part 1 and Part 2 is online. But for Part 1, all the RCS are providing online examinations. So yours was a single best answer type exam, where I guess you had 150 questions, right? If I'm not wrong.
Yes, I had 150 questions.
Can you just briefly walk us through your preparation and how was it? How many months do you think is required for any person, especially for someone who is most of the people, they say, I'm coming back to theory after a long time. So someone like that.
So basically, I started my preparation with, I think what you have to focus is on the foundation, and you have to read all your basic anatomy, physiology, oral pathology, especially dental materials. I prepared for 3 months, not more than that. I have been reading all along, but I started my, this exam specific preparation for 3 months. Not very intensive. I work daily. So every day, 2 to 3 hours after work. I basically focused on the pink book and blue book. You have to read it if you have to pass the exam.
Okay.
Also, I enrolled in like mock test with Dr. VINAY, which was very good it served as like a canvas and like a, where you don't really know what to study because the topic is very vast. You don't know what to study, where to study, and how much you have to study. For the exam, it did help me a lot. I took mock tests after I finished studying, after I did a rough revision, I started taking mock tests. And it did give me a rough idea on when and where I should focus on. So that was good for me.
That's good. That's good. Thank you so much. And yes, you have to take mock exams at least to know where you stand, especially when you're giving an exam which is prestigious. At the same time, it's very expensive, right? Considering all Royal College of Surgeons examinations. And the other question I wanted to ask you is, with respect to the Part 1, do they have specific syllabus like something like basics and clinical? Because RCSI clearly mentions what are the syllabus. For Part 1, do they have where you need to focus on both basics as well as clinicals? How does that work?
If you look at the syllabus for the Part 1 Royal Colleges of England examination, they don't give you a specific topic that you have to focus on. Initially, when I went through the syllabus, I saw it was all vague, and mostly I figured that all of these topics mentioned in the contents that they have given is on the pink book. So it's a must that you have to read the pink and the blue book. Or foundation topics like DM, anatomy, physiology, oral pathology, a lot of questions were asked. Also, you have to learn about how how dentistry works in UK, it is very important to know, like how the guidelines are, what are the rules here, what are the laws here. All of that you have to read. There are books like FGDP and stuff like that you can refer to if you want to learn all of that. Bolem test. You have to be aware of all of that. I think
You're basically talking about the ethics and law part, right?
Ethics and law, yeah.
Exactly.
I actually bought like a book called Ethics and Law from eBay or something, just to like read through what it is like.
Okay.
It is very important.
And can you tell me what is FGDP? I didn't get that part.
There is a book called FGDP. I saw it on some website and I actually bought it. It's all the protocols for taking radiographs, how you should handle complaints, things like that. It's basically ethics.
Okay.
But it's, yeah.
That's good. So the blue book, the pink book, and some references for the protocols, that should be a part of your preparation, right? Pretty much.
I think that should be the core. That's how I passed the exam. Like I did read like my textbooks for DM, oral pathology, and anatomy, and all of that.
Which books
but
did
you have to
for DM and oral pathology?
DM, like I bought my books back from India, like what I studied.
Syllabus, right? That's what we use
in my BD. Yeah.
Syllabus. And oral pathology. And the
I bought Schaefer's from back home.
Schaefer's, okay. That's nice. So that's good. And is there anything else you would like to add to your preparation? How was your exam? How was your exam experience? I think you have 3 hours to answer those 150 questions. How was the standard, and what difficulties did you face during the exam?
Initially, after I wrote the exam, I honestly thought I am not going to pass this. It was not any basic straightforward questions at all. Like, please don't expect any basics or straightforward questions. It's not. It's always application-based questions. They'll give you, it's all based on, like, the answers are all going to be pretty simple, but it's all application-based. And they'll give you like a scenario where, oh, this person's blood sugar is like this, and then you have to find out what and why. The answers are very similar, and it's very easy to get it like, confused with. And also one other thing is that a lot of people, like some of my friends wrote the exam as well, time constraint, because the answers are because the questions are very long, very lengthy questions I had. You have to sit and read. A lot of people could not finish the exam on time. Your window will all just shut down. Like, so if you don't like know questions, just flag it up. After you finish all the questions, just go back and read it. Don't just waste your time on like, I finished like 5 minutes or 10 minutes before the exam. Yeah, it's very lengthy. Initially I thought, okay, fine, like I'm going to finish this, or 150 questions I'm going to easily finish. Even for my mock test, I did like finish everything quite early. I take like 2 hours max. So I thought, oh, I could do the same. I could easily finish off and just sleep. But no, you can't. Like, you have to.
Lengthy questions. Did it have some sub questions also? Because
yes,
usually they give something like a scenario and ask sub questions based on that.
Yes. It's all application-based questions, not straightforward at all. Please don't expect any straightforward questions. Like, I didn't find like any straightforward questions, and the answers are all very similar. So you have to read the questions twice or thrice. There'll be a slight difference between the answers, and you have to like pick the right one.
Settle between the options and go through the question again.
Yes. It's very time consuming, to be honest. I initially thought I would not. I was surprised when I actually passed my test. That's.
And they give you your marks, right? And they tell whether you passed or failed. Okay.
Yes. It takes at least 1 month, more than 1 month, to get your results back. They'll send you a formal email saying you have passed the test and this is your mark.
Thank you so much for your time, doctor. And is it okay if I can share your email ID at the end of the video so that if somebody wants to reach out to you, they can ask you for some help? Yeah.
Yes, that's absolutely fine.
Thank you so much. Thank you for your valuable time.
That's fine.